Welcome to Beyond Bones and Muscles, a Legent Health podcast. Created by the team at Legent Health, a healthcare system devoted to helping you live life to the fullest. Your health, our priority. Each episode, Chief Operating Officer Daniel Brazel keeps your finger on the Legent pulse, going beyond the bones and muscles of Legent Health. We will discuss orthopedic and spine industry education and analysis, along with news from around the Legent healthcare system.
Hello, everyone. I'm Daniel Brazel. I'm President and Chief Operating Officer here at Legent Health, and I'd like to welcome everyone to our Beyond Bones and Muscles podcast. It's been some time since we've done a podcast, to be honest, and we're excited to really kind of restart this podcast going on a bit more frequently, related to industry-related topics, organizational updates, and really some of the driving forces behind the surgical space related to ambulatory surgery centers and surgical hospitals. But for today's podcast, I'd like to dig in on a topic that is a challenge for most healthcare facilities, specifically specialty hospitals, and more specifically, ambulatory surgery centers. And that has to do with the procurement of equipment, whether it be new, refurbished, the securing of maintenance agreements and getting, best pricing, looking at and understanding your inventory, right? What do you actually have within the four walls of your facility? What is the value of that inventory? How can you potentially monetize that? And specifically really looking at some of the challenges that small and large organizations have related to these topics, and what solutions, frankly, are out there to help individuals to really rise to that challenge of understanding the capital budgeting process, their equipment planning related to new facilities. So I'm happy to introduce Luke Johnson, who's the CEO and founder of CapExpert, an organization that has been founded for a few years now and has been a great partner to Legent Health in regards to helping us with all the items that I mentioned, equipment planning, the procurement of equipment, really leveraging some of our assets and liquidating those that may not be used. And they've just really been transformative in our ability to grow throughout the region. So, Luke, welcome to the podcast. And in addition to Luke, we also have Steve Donnelly, who's our VP of Real Estate and Development. And Steve is joining the podcast today because he's really aligned with CapExpert on our new facilities, the growth that we're seeing with our de novo locations, and how CapExpert's really benefited the organization and being able to achieve our goals and staying under budget and securing the right equipment. So welcome to you both. Thank you guys for joining the podcast. So Luke, tell us about your organization, sort of the thesis behind it, and where you guys have been and where you're going. Excited to hear about it.
Yeah, thank you. Once again, so CapExpert was founded right around 2020, right at kind of the beginning of COVID. And my personal story is kind of one of those classic ones that I was actually working for an outpatient surgery center management group, and COVID hit, and a bunch of people lost their jobs. Unfortunately, I was one of those. So I actually got to really focus on launching CapExpert from my parents' basement. But the initial idea for CapExpert was a redeployment marketplace for ASCs, clinics to buy and sell equipment to and from each other if it was underutilized. So really trying to help this new decentralized care model collaborate better, reduce redundant spend and waste. And our first feedback, this came from real life use cases when I was working for surgery centers. And the first feedback we got about the redeployment marketplace was, "Hey, Luke, this is a really good idea, but we don't even really know what we have, let alone what we're not using, and let alone which facilities would want it to buy something from their sister facilities." So that kind of steered us in a broader vision, which was, let's build an outpatient version of a platform to help these groups manage their medical equipment, see what they've got all from a single location platform so they can see it across multiple locations. And we thought we would be able to rely on existing equipment lists, whether it's your asset registry or maybe some biomed reports, and be able to remotely build this platform out for each one of these ASCs so that they could collaborate together. And what we found after that was that initial data was not very great, almost borderline unusable. It's really just kind of a consequence of how quickly the ASC world has grown. Lots of M&A, lots of new builds, and ultimately just some out-of-date manual entry for asset registries or whatever equipment list you have. And when you're a single site, you you have a pretty strong grasp on what equipment you got, right? But when you've got multiple sites, when you're a nationwide group, nothing is visible from an asset perspective, really. So that became our charge: was how do we make this national platform easy to onboard, keep the data up to date, and then let these facilities again collaborate better together. Whether that's relocating equipment to and from each other, divesting it, and really kind of monetizing some idle assets, and ultimately recapturing a lot of scale that some of these independent facilities or siloed facilities really don't get when they are kind of off by themselves in random markets throughout the country. So the last kind of light bulb moment, this was really the launching point for CapExpert over the last 2 years, was that last part I talked about, where that initial data set is pretty poor. And I had to go on site and do the onboarding of our first 20 facilities. And it was when I was crawling on my hands and knees trying to get the information off of a surgical table and doing some quick math. Hey, this is taking me 5 to 10 minutes per asset just to get the good data into the platform. And someday we want to have 1 million assets on the platform. It's going to take us 20 years, right? So we knew we had to go faster in order for us to scale, for us to be a feasible solution to our clients. And that's when we launched Capture. So Capture is like Google Lens, but for rapid equipment surveys. So as quickly as you could take a photo is as quick as you can inventory equipment. And what that unlocks is truly a multitude of value adds down the entire life cycle of a piece of medical equipment. That obviously can come in the form of selling equipment they're not using, connecting service contracts, being able to see the condition the assets are in, all the way to equipment planning for de novos, and reallocating useful assets into those brand new facilities in order to drive down the cost of opening these new facilities and being able to hit the ground running right after the first case starts.
That's fantastic, Luke. And I'll tell you, that was one of the initial benefits that we saw. Was we've got so many disparate assets across our facilities, across the 2 markets of Texas and Florida. The first question was, well, what do we have, right? And I think what you guys were able to do in deploying your team and really helping us to understand what is our current asset list, what is the useful life as far as the purchase period when we bought it, was it refurbished at the time, was it new, how much time left is on that piece of equipment, so that then we can load that into our capital budgeting process in regards to what additional resources do we need in the coming year, the coming 2-3 years, and then really understand our business a lot better. And then at the same time, something you mentioned that really helped us from a cash flow perspective was what type of idle assets do you actually have in your 4 walls? And if you're not using it and there is useful life left, liquidate it. Bring the cash in for that equipment. So, Luke, maybe talk a little bit more about that process, because I think that is really, well, I know for us that was a huge benefit, but what have you seen across sort of the industry related to other customers and really taking advantage of that specific piece, which most folks may not even think about?
Yeah, so we were able to inventory one of Legent's specialty hospitals. It had, I think 12 operating rooms. You guys have some really impressive facilities, but we were able to inventory that entire specialty hospital. I think it had north of 3,000 or 4,000 unique assets at that one location alone in a day and a half with our team using our mobile app. So like you said, the benefits of that are we're not interrupting patients or care delivery. We're able to collect all the information really quickly and deliver it to you, within 48 hours of that last photo being taken. Legent was also, you guys are not alone in that you guys had a couple storage units off-site. And in those storage units were assets that were no longer being used. Maybe you stopped doing a specialty, maybe a surgeon retired, what have you. But, we've seen not just across you guys, but many other clients that have assets that are in storage units and kind of waiting to be reallocated. But oftentimes what's out of sight is out of mind. So what we're able to do is we went to those units to go do those inventories as well and instantly find quick opportunities. So when another Legent facility was going to purchase something in that category, let's say it's a patient stretcher, and before sending out that RFP on our platform to vendors to try to go find a good price on a patient stretcher, we were able to identify, wait, hold on, you've got some patient stretchers in storage up in Dallas. And you'd be able just to move those down to your facility that needs this stretcher for no cost. So,
Yeah.
it's wins like that. Obviously, the reallocation, reducing redundant spend, but then also being able to, we find about 10% of certain categories are actually underutilized or completely idle or need repair. And so you've got those, the valuable square footage in the outpatient facilities that we can give back to your facilities, not only the space, but obviously we're able to create a very competitive market for other facilities, third-party refurbished companies that want to buy quality certified or quality used equipment so that they can recertify it
Yeah,
and stuff like that.
fantastic. Yeah, we definitely seen the yield on that piece. So that's dealing with our existing locations, right? Understanding what we have, what do we need, what do we not need, how to plan for the future for our existing locations. But as I mentioned at the onset, we've got Steve Donnelly, our VP of Real Estate and Development, on the podcast as well, because I want to talk about de novo locations, equipment planning, and how your organization, Luke, has really been able to partner with us in being really an extension of our organization related to being able to rapidly assess and plan during a really rapid growth period for our organization. So, Steve, if you don't mind, maybe briefly introduce yourself, your role and scope, and then at a high level, how has CapExpert benefited the organization related to your department, and maybe give a couple case studies as well.
Sure, sure. Thank you, Daniel. Yes, we went through the chute pretty quick with CapExpert with a couple of projects with Austin and Fredericksburg. And I think that there's a misconception in the healthcare world about when a medical equipment planner needs to be engaged on a project. I think people like to put the decision making on equipment off as long as they can. When you look at projects like ground up surgery centers, the Carrollton project that we're about to embark on, these things can be 18 months or more to get completed. Yet the information that we need on the medical equipment needs to be within the first 6 months. There's so much information that is required about a piece of medical equipment, whether it needs structural support, medical gases, electrical, power, the size of the equipment, what kind of access do you need to the equipment for maintenance and repairs. And that's what CapExpert has been able to help us define for our projects. So they go through a process where they'll focus on architecturally significant equipment, which means it's going to have an impact on the design. And they'll put a medical equipment planning book together for us. And these books could be hundreds of pages of technical data that our engineers and our architects are going to need to be able to design the space. So Luke's team, like I said, has done a fantastic job getting into our projects quickly. With the first two projects that we gave them, they kind of came on board a little bit late, but we were able to accommodate all the equipment that was asked for. And so it's made for a smooth transition. I will say on our Carrollton project, which they're already engaged on, it's a little bit different for us because not only are we relocating equipment, but we're buying new. So this is the first time that we're having the combination of both. And so far, they've put all the information together that our architect and our engineers need to make sure that we have a successful project.
Yeah, that's fantastic. Luke, maybe tag on to this topic related to equipment planning and the infrastructure that you guys have built to be able to successfully deploy that. Because obviously hearing from Steve, for our organization, it's been a monumental success, right, and really helping us. But maybe expand that to the sort of the broader industry.
Absolutely. I want to start with the Carrollton project, as I was actually in Dallas not too long ago when the team, our whole equipment planning team, actually traveled and went on site to the facility you're closing, and they reperformed the inventory of over 700, 800 unique line item, shelving, racking, trash cans, all the way to your biggest imaging equipment that you guys have. We did all that in half a day. And they're able to use that foundational data, like Stephen said, to pull all the spec sheets, all the books that we need in order to work collaboratively with the architect to make sure, hey, these are all the items that are relocating. And then also these are all the items that are not going to relocate. What can we do with it? Where can we sell it? How can we monetize it? Can we move it to other facilities throughout the Legent network? So That was a really great exercise, and I'm really proud of the work that the team's doing there. As far as equipment planning in the outpatient space in general, it's such a unique dance, I think, between the clinical feedback and necessities and then the business case, right? I mean, Daniel, you've seen the number of ASCs. If they're improperly planned, whether it's
Hmm.
overspend on equipment from the outset, if it's not, Stephen, you mentioned how early equipment planners should be involved, the design of your SPD, all those things, those lead times are really long. And it's not just lead times for delivery, but for the installation, the water, the power, everything is so critical. I've got a fantastic team of really detail oriented people that have both clinical and obviously equipment planning backgrounds. So when we jump on these calls to have these really in depth strategic conversations, that's what really differentiates ourselves from your typical equipment planner or trying to do it yourself. We're able to to facilitate the right strategic decisions, whether that's trying to target specific equipment categories where you want the lowest cost possible. So we try to search for reallocation opportunities first, and then maybe certified pre-owned, and then we'd look at net new equipment from OEMs. Or with the physician being and the clinicians being so critical to an ASC, where a single person can be responsible for millions of dollars a year, making sure they get everything that they need to be clinically excellent and deliver the care to the standard that you guys demand of your facilities and that your patients deserve. We need to make sure that we help fiscally make that happen. So how do we afford the ultra high end, high performing medical equipment while coming in an
Right.
affordable budget? So that a product isn't set up to climb some pretty tough walls
Yeah,
in the very
100%.
beginning.
Yeah, that's a great point.
And I'd like to maybe add on one other thing that CapExpert has done that has really filled a gap for us. As after we've identified all of the equipment and we've started to procure the equipment to the job site, there's a huge coordination effort that has to happen with when equipment is ready to be delivered and installed on site. And so CapExpert has helped us with not only receiving the equipment, but making sure that it's marked on the equipment list, that it's been received, that it's operational, that it works, it's been tested, all of those kinds of things to ensure that the entire medical equipment list has made it to the job site and that it is as it was spec'd. So, without having sometimes in situations we may not have people hired at these new locations yet to help with that process. And CapExpert has really filled that gap for
Yeah,
us.
when you think about larger scale organizations, larger health systems, larger ASC platforms, they've got full teams that are handling materials management, supply chain at the corporate level. They got equipment planning folks specific to de novos and or aqua novos where you're doing more of a retrofit. But for smaller organizations like ourselves that haven't, and may not reach that larger scale as far as hundreds of facilities, it's challenging to resource that from an expense perspective because you don't want to overstaff. You may not always be doing a de novo.
Right.
You're not always doing capital budgeting. So the benefit that we've seen from my lens, sitting in the seat that I'm in, is a financial benefit as well to leveraging CapExpert as a partner, because what potentially could be 3 FTEs at the corporate level to assist with all these different components of materials management, supply chain, the contracts with the vendors, the procuring of the equipment planning, and sort of the list goes on. We can simply leverage our partner who's got the muscle, who's got the subject matter expertise, and understands the industry trends, has the vendor relationships. So for us, it's been a significant financial impact as well to the positive by not having to overstaff when you may not necessarily need those folks 365 days a year, but are more project specific. So I think that's been a really big benefit to leveraging the CapExpert platform.
Yeah, Daniel, that was our thesis from the beginning. The thesis was, if we can help lay that foundational data, what can you do with it afterwards? Can you leverage it to have better purchasing on your de novos? Can you leverage it to negotiate better service contracts? All the above. Everything kind of starts with that foundational data set because we truly believe that the future of supply chains and healthcare in general
Yeah.
are vertical, meaning you're going to have a much closer collaboration with facilities, your biomed firms, whether it's they're in-house or third party, and getting that critical information and updates about your equipment all the way up to the key decision makers on whole new facility build outs, and having a single platform, kind of the new operating system to manage all that data, all that expertise efficiently, to your point, is exactly the thesis of why CapExpert's, we're pretty excited about where we're headed as a company.
Beautiful. So actually that segues into our closing. Where is CapExpert going next? I mean, you guys have where you were a startup. I know you've got some, a lot of growth. You've got new partners, et cetera. But what should we be looking forward to relative to CapExpert?
You continue to see us trying to dominate the outpatient space. I think, me and my co-founder, Devin, we come from the outpatient surgery center space, and we truly believe we can be a full stack solution in this industry. As we look up and down market, our capture tool has a lot of demand in the acute space by OEMs, by other biomed firms. AI can do a lot of really fancy things, a lot of really exciting things. But what's very useful today, especially in healthcare, is very, very practical solutions. So conducting a manual inventory of all of your equipment is slow, often super inefficient, expensive, and even inaccurate at the end of the day. So what Capture can do, it's powered by computer vision, is the fact that we can get you a clean data set on your millions, hundreds of millions of dollars worth of medical equipment in days versus manually it would typically take months, is a really, really powerful jumping off point and a very practical use case for multiple stakeholders. So that's what you can see. That's what we're going to be focused on over the next year or so, is continuing our full stack development and onboarding of some major outpatient groups in that space, but then also the adoption of Capture in particular in the hospital space and by OEMs and service contract providers as well.
All right, fantastic. Well, it sounds very exciting for CapExpert, and your partnership with us has been transformative, as I mentioned at the onset. But I will say, don't get too big too fast, because I need you guys to still keep up with us. What I will say in conclusion is Legent Health has some very exciting announcements to be coming in forthcoming podcasts. And I think these announcements will really run in conjunction, Luke, with partnering with you as we look to have rapid growth across the country, frankly. But more to come on that topic. But we really look forward to continuing our partnership with CapExpert. I'd recommend if anyone has questions or wants more information, obviously you can reach out to Luke and his team. But they've been a great partner. I think they're a real asset to the ASC space and, frankly, the surgical space in general. And I just appreciate your partnership, Luke, and thank you for joining the podcast. And Steve, also thank you for really sharing your insights into the benefits practically that we've seen from the CapEx platform. So with that, gentlemen, we'll go ahead and conclude. And I want to thank the audience for watching our podcast. And until next time, we'll talk to you then. Thanks, guys.
Thank you for listening to Beyond Bones and Muscles, a Legent Health podcast. We want to hear from you. Subscribe and leave us a rating. Your feedback helps improve our show. For more information about Legent Health, go to legenthealthservices.com.